Okay, thank you very much, Jane. Well, welcome everybody. It's great to see so many people online, even though I can't physically see all of you. But good to have this many people joining, and I can see from a huge range of backgrounds as well, which is really encompasses what we hope to achieve with some of this project, which is to be very inclusive and to bring people together that perhaps don't normally work together in order to achieve perhaps more than we could individually. So this first webinar is really to introduce a new branch of our FoodSEqual project called FoodSEqual Health, which is around tackling the dietary inequity that underpins health inequalities. And this is an additional funding stream that we were awarded. And with that extra funding stream, we're going to run an intervention. And the purpose of today is to explain a bit about that intervention, how we got there in terms of our decision-making process, our previous experiences of versions of that, and how we intend to evaluate it and what the sort of broader consequences are. So you'll see in the middle of the screen there the Fresh Street symbol, and that's the name of the intervention that we'll be telling you more about. And you can see the partners of this FoodSEqual Health part of the project arranged at the bottom, and of course it's all funded through the Transforming the UK Food System Strategic Priority Fund, for which we are extremely grateful. So I thought I would start by just setting the scene a little bit around how we got here and around inequalities, health inequalities in general, which is the driver for this. So most of you, I suspect, will be familiar with the 2 Marmot reviews. So the first one in 2010 came up with these guiding principles of that would deal with health inequalities. So really running through the life course, starting with children, enabling people at all stages of their life course to have control over their lives, have a healthy standard of living, to create and develop healthy and sustainable places and communities. So even back in 2010, we were talking about the importance of community and talking about the importance of preventing ill health as opposed to just dealing with it when it arises. And so, again, many of you will be familiar with the fact that the Michael Marmot did an update in 2020 to see where we were 10 years on. Unfortunately, things got worse rather than got better. So people can now expect to spend more of their lives in poor health. Improvements to life expectancy have stalled and even declined in some areas. We're seeing a widening of the gap between wealthy and deprived areas, so that that inequity space is getting broader. And we're seeing that place really matters. What I would say is, we hear an awful lot about the levelling up agenda and the focus on levelling up in the north. That's clearly incredibly important. What we observe, given that the places that we work tend to be in the southern part of England, is that the disparities that we see are huge in that space, because they tend to be rather wealthy areas. The areas of poverty rather get lost in area-based data, and when you hit regions of extreme poverty, the disparities between those regions and their neighbours are huge. And so I think the levelling up agenda actually applies to all regions of the UK. When we look at inequality in our food system, these data are a couple of years old now, and the graph that you can see on the right, it's one of the best of its kind, but it comes with a caveat in that it talks about the price of food per 1,000 calories. Now, clearly, some of the foods listed in this graphic are more calorie dense than others. Fruits and vegetables are some of the least calorie dense foods, but they are really valuable in terms of the nutrition that they provide in the diet through bioactives and so on. So there's a little bit of a caveat about how this graphic is interpreted. It's essentially demonstrating the principle that a healthy diet is an expensive diet, and that's the key message to get across here. However, inequalities can be challenged. We know there's a relationship between diet and health. If we look at the kinds of policies, as we have done in the Parent FoodSEqual project, that underpin food and our food system, they don't really mention health, despite this huge body of evidence that links diet with health itself. So fresh produce is expensive, it's inconsistent in terms of quality, and of course it's perishable. This makes local shops unwilling or unable to stock fresh produce that's of good enough quality that people actually want to buy it. And at this stage, even the idea of risk and the influence of people's lifestyles on their willingness or ability to use fresh produce in their diets is really starting to come out. And that we'll come back to that a little bit further on in the presentation. So before I get into where we're going with FoodSEqual Health, I thought I would just give a very quick overview on sort of how we got here, because not everyone in this audience will be familiar with the FoodSEqual project. FoodSEqual is the big overarching project. It started in 2021. It's to address the whole of our UK food system, but focused on disadvantaged communities. We have 4 communities based in England that are on the edge of large cities or towns. 2 of them are coastal, 2 of them are inland. We are focusing on 2 of those in FoodSEqual Health, 1 coastal, 1 inland. So we're focusing on Plymouth, which has real pockets of social and economic deprivation. And there's certainly a street in Plymouth that has a discrepancy of 11 years in life expectancy between one end of it and the other. Very high levels of child poverty and high numbers of young people who are identified as food insecure. If we come on to an area of Reading that we call Whitley, it's a much more urban community in some ways. It's a low-income, left-behind community, but characterised by people who are in work by and large. The area has a very good community base, as does Plymouth. The Whitley Community Development Association, who are partners on FoodSEqual Health, already have got this informal supply chain with local supermarkets and so on, who provide unsold produce to the community centre, which is then distributed through the food surplus. But they have quite different dynamics as communities. I would say there's probably more experience of homelessness in Plymouth than there is in Reading. The people in Reading have got access to larger gardens, but because they're in work and often working multiple jobs, they just don't have the time or the skills necessary to use those in terms of growing food. We spent the first part of the FoodSEqual project doing some benchmarking, and I'm just giving a couple of highlights here. So we bought some Kantar data, and I give you a couple of contrasting illustrations. The data are segmented by socioeconomic status and cover a 3-year period. The top graph is spend on a commodity, in this case bread, by absolute amount of money. And the bottom graph is a spend as a percentage of the total shopping basket that was purchased at that time. And you can see for bread, if you just look at the top graph and the spend across the period, it's quite flat. Our group E, which is the group that we're most interested in to represent our communities, sits somewhere around the middle there in terms of spend, no great discrepancy. As a percentage of the shopping basket, actually bread forms a higher percentage of the shopping basket than for any of the other social groups. And you can kind of start to get a bit of a picture. That contrasts with the picture for fresh fruit. If you look at the absolute amount spent, you can see that our group E down here are very much lower than the other groups, and it's actually AB is characterised by being a much higher spend, both by absolute amount of money and as a percentage of the shopping basket. We're seeing for fruit, perhaps not surprisingly, an increase in the summer. And we'll see as we go on that actually the preference is for soft fruits and berries and so on. So there's a seasonality to that. Although it's possible to purchase them all year, clearly the price goes up when they're out of season. if we summarise a lot of that benchmarking work that we did within FoodSEqual, looking at the composition of the shopping basket, this was using a whole range of nationally available data sets. So not only the Kantar data that we purchased, but the National Diet and Nutrition Survey, Living Costs and Food Survey, Family Food Database and Food and You. And you can see that there are a number of food groups where the spend is similar between socioeconomic groups. Somewhere the more disadvantaged communities spend more, and things like fresh vegetables, carcass meats and so on, where disadvantaged groups spend less. So we started to get a national picture. However, these communities are sometimes referred to as the hard to reach communities. We were not always content with the idea that the national data sets might actually completely reflect the people that we're working with. And they certainly didn't provide a context as to why people purchase what they do, or indeed don't purchase other things. So we were able to explore that a bit more, and we'll come back to creative methods again and again. Where we possibly can, we've used creative methods. We work with our communities, so we take these national data and then we look in more detail, clearly with smaller group sizes, but we try and provide a context for those data and to interrogate them a bit and to say, for our communities, is this actually an accurate reflection of what we see experienced on the ground with our disadvantaged communities? So we ran a number of workshops in both Plymouth and Reading. We divided them up into different types of subgroups, and you can see for the Reading ones that we looked at families separately from people living alone, people who have children or require special diets and so on. And we not only explored what people eat, but why they eat it, what they would like to change, what their food aspirations are. Throughout these conversations, which provided really rich qualitative data, we started to get a picture of how food is regarded within families and communities and households. And some of the things that came out of it was really the stress and the anxiety around food. Or food is a reflection of the broader stress and anxiety that experiencing disadvantage actually results in. So there are some commonalities around a desire to improve nutrition in the household, but you want to do this something that everybody likes. You can't afford to put food in the bin, so there's limited scope for waste, and so there's a constraint. You can't afford to buy new things. You can't afford to cook in ways that require more energy. It's hard work to try and cook different foods for different members of the household who may be unwilling to try new foods and so on. Part of the FoodSEqual project is also around the sustainability of our food system, and we did start to explore some of this with our groups. Probably there was a little more traction in Plymouth around the concept of packaging and a concern around that. I have to say in Reading, the environmental side of things and things like animal welfare didn't really feature that much in the conversations, a little bit around reducing packaging, really a feeling that this is something that people actually have to deal with, whereas things like carbon footprints of food chains were a bit too distant, that they weren't something that people felt were tangible, that they could change. So to try and summarise our aspirations for change that we found, I think this is sort of one of the first illustrations that the project can have guiding principles of what it's trying to achieve, but that you end up with very locally nuanced answers that are different. And that's where, when we're thinking about designing food policies in the future, we have to have policies that can be made to work for communities in different areas, that are culturally appropriate, that are appropriate to the kind of lifestyles that people have and the things that they recognise as being important to their area. So fish, for example, real desire in Plymouth to be able to use local fish and a wider variety of fish. To be honest, in Reading, really wasn't that much enthusiasm for fish, particularly if it was unprocessed. So that was a really big contrast. But we are seeing in all of the communities that we've worked with that the issue around availability and affordability and the quality available of fruit and vegetables is really important, and that seemed to be a cross-cutting theme, and to some extent that's what informed FoodSEqual Health and the choice of our intervention. So the intervention, as I said, is called Fresh Street. Now this is an area-based intervention done at the community level, so very different, for example, from some of the nutrition or clinical trials that some of you on this call will be familiar with, where people from the community come into your facility. Everything is happening out there in the community. It's an area-based intervention providing fruit and vegetable vouchers to approximately 300 households in areas of high indices of multiple deprivation for 12 months. Clearly we have to deal with access to fruit and veg, and so we're very grateful to our fruit and veg vendors who have agreed to work with us as partners and come in and provide the fruit and vegetables. Now we're doing that through two different routes. So in Plymouth, with Tamar Fresh, we're going to be using what's essentially an online ordering system, although online in a very broad sense of the word, in that digital access will not be a barrier. It's likely to be that people can work with the community researchers so that they place an order. But that's in contrast to what we plan to implement in Reading, where we are setting up the equivalent of a market stall so people can see what they're purchasing at the time. And some of that is just due to the way that our fruit and veg vendors are able to work to adapt their businesses to be our partners. And that again is another really important lesson for how to deliver these interventions. If you were thinking about placing it into a different area again, is working with your stakeholders to see what works best for them in your situation. We will assess diet quality, well-being. We will assess some health markers, although we're very cognizant of the fact that a 12-month intervention is not going to be long enough, we don't think, to show real changes in health status. But if we don't start measuring now, we'll never know. So we're going to start measuring the health markers and hopefully be able to carry that on for a longer period of time so that we start to see real impacts on health in due course. We're addressing the problem of food affordability. We're really interested in working with the public health teams who are on board with us to really try and get a handle on whether these types of interventions can make a real difference to public health in the long term, and the importance of social connectivity. And that's where this version of Fresh Street perhaps differs a little bit from the types of things that Claire will talk about in a minute, in that the social hubs, the community hubs, are really important to this. We will do a process evaluation throughout the project, so the process of implementing the intervention, how the mechanisms of action of it, and the factors that impact on its success. And this last bullet point is really, again, making this point that we've got central core research questions that are common across both areas, but the delivery of the intervention is adapted locally. And that will be really important when we come towards the end of this work, when we start to be able to perhaps give advice and consultation to other areas that might want to implement a version of Fresh Street, is how do you do that? How can you adapt that in your local space? So our primary research question is around finding out what the most effective way is to embed Fresh Street community scheme within local food systems in areas of high IMD. And then we have a bunch of secondary research questions looking at the most effective methods for households to both receive and redeem vouchers. There's a centralised vendor payment system, which is being upgraded in this version. The impact of Fresh Street community on social connectivity, health inequalities, dietary behaviours and wellbeing status, and the availability and affordability of fresh produce. We want to know what the acceptability of Fresh Street community is to not only the households receiving the vouchers, but also the vendors, local authorities, other stakeholders such as public health teams. And from that, actually build this return on investment case. Our absolute dream is that local authorities will see value in supporting this kind of intervention and the benefits it has. And we will, I'll come back to that towards the end of this webinar. So to briefly kind of illustrate the intervention design, the slight conclusion is that the areas of both Plymouth and Reading are both called Whitley, although spelt differently. So I will continue to call them Plymouth and Reading because it stops too much confusion. So within each area, a number of streets will be identified that represent around 300 households in each place. Those streets are in areas of high IMD and near to community hubs. In Plymouth, we have Tamar Fresh supplying through, as I say, this sort of semi-online ordering system. In Reading, Belchers are our partners, and we will set up a market stall with their produce. Both of these partners are wholesalers, so they're not set up for retail particularly. So we're incredibly grateful for their participation in this and their partnership. So in each area of those 300 households, half of them will receive fruit and veg vouchers. It'll be £10 worth once a fortnight. Half of them will not receive the vouchers, but both groups, both the control and the intervention group, will receive the programme of community hub-based activities. And I'll illustrate some of those in a minute. So they get all the support. And of course, the households that don't receive vouchers are still free to purchase the fruit and veg from Tamar Fresh or Belchers. So they will still have access to fruit and veg that they don't have now. It's just that we don't address the affordability aspect by providing them with vouchers as well. From those streets and those households, we plan to recruit 100 individuals from both the control and the intervention group in both areas, and we'll conduct what we call a food and wellbeing chat. This sounds quite soft on purpose, and it's a point that the language that we use is really important. So as soon as we start to use the word interview or 24-hour dietary recall, food frequency questionnaires, these are all quite off-putting. And in fact, the food and wellbeing chat really captures elements of a number of different things. So it captures 24-hour dietary recall, but through a much more conversational route. It captures elements of well-being surveys, of the food affordability survey. So we've picked things out, put them together, packaged them and deliver them in a way using our community researchers who are of the communities that they're representing and working in, to really gather this very, very rich data set. We do it at 3 points during the course of the intervention. And that last point, that month 32, is when we're going to go back and do it again, right at the end of the parent FoodSEqual project, where hopefully there's been enough time elapsed to really see a shift in dietary behaviours. We then have a couple of other bolt-ons to that. So as part of the parent FoodSEqual project, we're also conducting dietary biomarker assessment. Many of you on this call will know the issues that arise from people being asked about 24-hour dietary recall, about food frequency questionnaires and so on. Providing these biomarkers gives an independent assessment of diet quality. So people who do the food and wellbeing chat will be offered the chance to go and provide the biomarker samples, and they will get additional vouchers, not for fruit and veg, but for supermarkets for participating in that. And at both of our community sites, we are working with our NHS partners who provide health checks. And we are using this as a forum to encourage people to attend those health checks. Now, we won't capture data from individuals. I mean, the NHS will, but we won't access those data. We're interested in this as an area level intervention. And so we will be able to understand whether the health status of people in that area has shifted rather than individuals one by one. All of this stuff is underpinned by a huge programme of local activities, and there's really key features of this that have come through from the Parent FoodSEqual project. Co-design and co-creation is really important to us. and to the communities we work with. Our community food researchers are just a brilliant team who have been recruited from their own communities where they're working. They see it as really important that the representation that they provide for their communities. They are the trusted voices. So we get much better quality data, much better engagement. And it's a real message that doing this participatory action research, it's hard work, it's quite resource intensive, there's a lot of training involved and so on, but you get such good quality outcomes from it because you really understand how it really is on the ground as a result of this. So we make a point of it being inclusive, of using social spaces, of making this a very welcoming, friendly thing to do, that it's not about being judged. It's not about having to go somewhere where you're being sort of examined, as it were. This is something where you can feel that you're making a real contribution. And those communities are developing activities and events and so on that reflect what they are interested in. So they're able to drive their own agenda. And that's not something that happens every day in their lives. And so this is a really important message for trying to do these sorts of things, is to find ways of understanding what matters to the people that you're trying to work with. Huge numbers of creative methods are coming out of these projects, driven by our community food researchers, I have to say, with the real oversight of people like Claire Pettinger from Plymouth, who's used creative methods in her research for many years and is just an inspiration in this space. It's a real component of co-production. I mean, you know, we just say not another survey, not another focus group, not another interview, because, you know, a lot of people from these communities get focus grouped and interviewed to death, and they get pretty turned off by it. So by being able to use creative methods that they themselves have had a voice in designing, and communication styles that work for them, we get much better participation and, I think, commitment to the project, and better quality data as a result of it. We will be appointing food and health champions within each community. We know that from work done by our local authorities that things like vaccine champions have been incredibly successful, and we want to take that one step further. And just an illustration on this slide of the sorts of things that have taken place in the past that we might sort of build on. So the top left little Facebook post was around a session of walking netball. Walking netball now happens quite regularly in Whitley, Reading, and this arose from something called a knit and natter group, which sometimes impolitely is referred to as a stitch and bitch group, but you can make of that what you will. But there, people were sitting around and saying, yeah, we're having a great time, we're meeting each other, we're doing we're having a great time socially, but we're sitting around, we feel we ought to move. So, yeah, what can we do to add to that? And so, rather than someone saying, you don't move around enough, you don't take enough exercise, you need to do some sport, and that would be quite a turn off, by the fact that people have said, you know what, we feel we ought to do something, and it comes from within the community and is driven by them, the engagement and the take up is so much better. Meet Pete that you see on the top right, these are our NHS colleagues who are doing the health checks in Reading, and you can see they come out wearing t-shirts, they're bright and smiley and friendly, they get to know people, they don't come out looking like authority. A whole range of other creative methods that you see in the bottom panel. I draw your attention to the Whitley Community Cookbook that came out of Plymouth. Do click on the link below when we share the slides, because there are some really interesting recipes and stories within that that show just what a community can do when it's given agency to do so. So that's a little bit about Fresh Street. Next time we meet on one of these webinars, we'll give you an update on how it's going. We will start rolling out these interventions in October, which is seeming remarkably soon. We'll be looking and reporting on the feasibility of delivery. So we're going to start by delivering vouchers into households, and then in January next year we will transition to delivering the vouchers to the community hubs, as well as expecting people to go to those community hubs to place their orders and collect their vegetables. We will start to report on the impact of dietary behaviours and well-being, the acceptability of the scheme, social connectivity, engagement with those social events, our food and health champions, and so on. So please come back to us and find out how it's going, and hopefully we'll have some good news to share with you. And as I say, these slides will be shared, so you then have our contact details if you want to find out more about the intervention and indeed the broader FoodSEqual project. So I will leave that there. And I'm going to hand over to my colleague Claire Relton to take us through some previous experiences of Fresh Street.
Hi, can you hear me? And can you see my slides? Is that all good?
We can. Can you pop them onto the
I will do.
Display version? Thanks.
Yeah. All right. Okay. Great. So so my name's Claire Relton. I'm a consultant on this project and also a senior lecturer in clinical and public health trials at Queen Mary in London. And I'm absolutely delighted to join the FoodSEqual team for FoodSEqual Health, and Carol and her wonderful team in Reading and Plymouth. So I'm here to talk about a little bit about what's been happening so far with Fresh Street, which is an idea that we came up with at the University of Sheffield way back in 2017. And we've tested now in 5 areas of high deprivation in working with local public health teams in each area. So I'm going to talk quite a lot about the very first feasibility study, because that sort of set the tone with actually us understanding the high levels of idea, and then I'll talk a bit about what we found out with the following other 4 areas and how we've refined the scheme. So that's that. So we first tested the idea, or developed the idea, in Barnsley in an area of high deprivation. So this is a lovely community centre in Barnsley, and we spent a couple of weeks working with people locally about the idea we had, and it got refined. And then this is what we agreed to test, which was that we would have a scheme where all households were included regardless of income or size, and each household would get £5 worth of vouchers every week for every household. So vouchers could be used only with local fruit and veg vendors, and households were also able to share. So that's what came out of the community consultation right at the very beginning. And how we decided to share the vouchers was with a weekly letter. So we dropped an envelope through the letterbox of each household every week, and it had a sheet of paper with a recipe and some nutritional information, very simple nutritional information, which is about how important it is to eat 5 a day, how 7 a day is even better. And then it also had a lovely veg-based recipe, just a nice simple recipe. So with funding from the MRC, the Medical Research Council, we were able to test the feasibility of this idea. So the area we picked was, we actually found a fruit and veg shop called 5 a day in an area of Barnsley out to the west, and they agreed to be the fruit and veg vendors there agreed to join the scheme. And then we chose 4 streets that were all quite near to that fruit and veg vendor, and these were randomly selected. And then also we recruited a fruit and veg vendor in Barnsley Market, which was 2.5 miles away, city centre, and cost £2.50 for a bus ride. So people could use the vouchers somewhere locally where they could walk to, but also if they'd happened to do all their shopping in Barnsley Market, then they could go there as well. So we started with 4 streets, which had a total of 99 houses, 2 of which were unoccupied. And we door knocked and dropped leaflets through saying that we were starting this scheme. And at the end of the first week of us actually delivering the scheme on the ground, 37 households agreed to have vouchers, but quite a lot of people were very, very wary. They were thinking, is this too good to be true? What's the scam? What's this about? So actually it was really interesting. But as people actually started to use the vouchers, they then started to tell their neighbours about it and say, yeah, you can use the vouchers, it's fine. You can give the vouchers to the fruit and veg shop and there's no problems. You just hand them over and you get decent, really good fruit and veg. So it was through different people, different households talking to each other in the community that meant that really helped support the the take up of the scheme. And then so by week 8, so 8 weeks in, a couple of months in, almost I think 90% of households actually said, yeah, we're going to use the vouchers, and we'd started using them. And people became very positive. Brilliant, smashing, glad I was persuaded to sign up. See, they had to be persuaded initially. It's a brilliant idea. So that was lovely, but it was really important for us to understand that, they didn't know us from Adam, us researchers coming in from Sheffield University. So it was important to build that sort of trust. And the proportion of vouchers that we were giving out, almost 90% of them were being redeemed. Most of them at the local shop, which people could walk to, which was just hundreds of yards away. But a third of them were actually being used at Barnsley market stalls. So we had enough money for the vouchers from the MRC for 6 months. To deliver the scheme for 6 months to these 4 streets and 99 households. But the scheme was so positive. The people on the ground were very positive about it, and they had an area council in Barnsley, where Barnsley main council would give the different areas pots of money and then say to the different areas, you can use it on what you want. So we went and did a presentation to North Area Council, and of course we were working closely with the council for the area, and they were really keen, and they actually managed to offer us another £8,500, which meant we could extend the scheme for well over 6 months to the household. So that was great. So it showed there was really local buy-in at many different levels. So the fruit and veg vendors, the households, and also the local councillors. So we collected information about the impact of this scheme in various ways. One of the ways was we would just go and door knock and say, here's your vouchers, and ask, and then talk to local people and see what people said. And the gist was, people would say, well, because it's free and because they buy the veg, it's there, then they eat the veg. Vouchers are a big help to cost. It's not about the value of the vouchers, but the fact the vouchers reminded her to fruit and veg. So we also realised the power of the vouchers and the weekly recipes as a bit of marketing for fruit and veg, because we know many processed foods get lots of local and national marketing, but fruit and veg doesn't get much big up in the marketing world. And also it helped people think about their diets and spurred them on to eat more veg and of course, obviously help their budgets. One of the things that was surprising to us right at the beginning, it's probably not surprising to the FoodSEqual Health team, but how often when we talk to people about the vouchers, the very first thing they would say is they'd talk about their health. They'd talk about their health conditions, themselves or their families. They'd also talk about health behaviours, about their smoking, dieting, slimming well, dancing. And some described how the vouchers were actually helping them to improve their health, which was fantastic. Hair is better, nails better, doesn't get so many mood swings, more energy. I think 2 people decided to join Slimming World because they now felt that they were able to buy the fruit and veg they needed in order to go on a diet. So that was fantastic, seeing all the little impacts of these £5 vouchers. Quite a few people reported new patterns of how they purchase fruit and veg. So some started going to the local fruit and veg shop who hadn't been there, even though it's just around the corner. And some started going to the fruit and veg stores at Barnsley Market instead of supermarkets. So people, not everybody, some people wouldn't use the vouchers at all because they said, I just do all my shopping at the supermarket. But some people said, actually, I'm going to change my pattern, and they actually did. So spending and eating, many people reported eating and spending more on fruit and veg. Never had eating lots. Oh, so quite a lot of parents would talk about their children's being able to help themselves to fruit and veg, and how much they loved having a fruit bowl in the house for the kids. People talked about trying more varieties of fruit and veg rather than just sticking to their apples, onions, and mushrooms. It also allowed people to experiment a little bit having the vouchers, because they could risk actually using the voucher for something which they might possibly not like. So saving money and eating a bit more veg, I think, sort of sums it up nicely. So we would deliver the vouchers each week in this envelope, and along with the envelope there would be a little letter, and in the letter there'd be a recipe, and there's a bit of nutritional information. And we were surprised actually about how many people mentioned using the recipes. There were just recipes that us and the team created. Some people I know actually kept them in a folder. So they created. We've now got 52 veg-based simple recipes. So they liked them. They didn't like my nettle soup recipe. So when nettles were in season, I put in my nettle soup recipe. But it got people talking about fruit and veg, which I thought, wait, hey, that's a good thing. We also encourage people to share the vouchers because it's about empowering and supporting and encouraging communities to have access to fresh fruit and veg. It's not about individuals. So we said that, feel free to share the vouchers. So quite a few people talked about sharing them with other families. A couple of people talked about saving them up and using them at Christmas when people were like trying to work out how on earth am I going to have a big family Christmas when I can't afford to buy all the fruit and veg for that meal. Some people would use the vouchers and if they had a few left over, they'd share with their families. And some people wouldn't share at all. They said, actually, no, £5 are about right. It's enough to make a difference to me each week. And then when we didn't have any more funding to continue the scheme, we had the slightly painful chats with people about, well, what about when the vouchers stop? And many said they would continue to buy the same amount, never going back. But others would say, well, I'll have to cut back. I'll buy less, buy more cheaper things, won't buy as much fruit and veg. We'll have to reduce the amount they buy. So that was... So after that, we thought, well, this has gone even better than we anticipated. Then Sheffield City Council came to us and said, well, could you try it in some blocks of flats in Gleadless Valley in an area of high deprivation and a food desert in East Sheffield? So we said, yep, okay, we'll have a go. So again, in Sheffield, they've got market stalls in the city centre, which is again about 2-3 miles from Gleadless Valley. And here we worked with a local food co-op, which was supporting an organisation that was supporting a local food co-op in the Gleadless Valley. So that's the valley that you can see these block of flats is situated in. And their local food co-op, they went and pre-packed fruit and veg bags. So they weren't bespoke. So it was just the bag of the week. It was mainly veg. It was mainly local and UK-based veg. There wasn't any exotic flown-in veg. And then the bags, if people said, yes, I want a pre-packed fruit and veg bag, they were delivered to the community room at the bottom of the block of flats. So what we learnt from that was, so people could use their vouchers either for a weekly pre-packed fruit and veg bag, or they could exchange them at 2 market stalls in Sheffield. What we found, though, was that most people prefer to choose their own fruit and veg. They didn't want a pre-packed bag. They wanted to, just look at and choose the veg that they wanted. So it sort of underpinned the importance of choice. We then, a couple of years later, we got some funding from the NIHR to pilot to actually do a much larger scale study in 3 areas of high deprivation in Tower Hamlets in London, and then in Bradford and in Doncaster. Both in food deserts in Bradford and Doncaster, but not in Tower Hamlets. They've actually got lots of really great fruit and veg stores. So the design was a pilot randomized controlled trial, and we were comparing what happened in streets where we offered the scheme to streets where we didn't offer the scheme, so similar streets that were randomly selected. So that's one of the streets in Tower Hamlets, and hopefully I've got somebody called Salma online who's actually going to have a chat, and I'm going to ask a few questions. So Salma, are you online?
Yes, I am.
Oh, brilliant. Thank you so much, Salma, for joining me. So Salma is very bravely.
Thank you for giving me a chance to take part, in your group.
Thank you. You're very brave, Salma. So you're going to keep your camera off, but thank you for unmuting. So I've just got 3 questions.
Okay.
So Salma's lives on one of the streets in Tower Hamlets, and so I'll ask you, what did you first think when you got the letter through, seeing that your household and every household on your street was going to get weekly vouchers for £5 for fresh fruit and veg and a recipe for 12 months? What did you think?
I was very happy. I was very happy, like over the moon. £5 is a lot to us, for our community, especially like during pandemic time, I know how much is with the cost of living crisis. It is very, I mean, difficulty for everybody, so this is very helpful. Like during pandemic, after pandemic, I know how people are suffering. We are even suffering ourselves as well. So when I received this news, like we're going to get a voucher for 6 months, £5 each week, I was really happy. I was start to, spreading word to my neighbors, like the good news is coming to our area. So yeah, it was really nice and helpful with everybody. Yeah,
That's
thank you
great.
so
And
much.
you've got
Yeah.
that's great. And did you use the recipes at all?
Oh yes,
Were they
yes,
help?
of course, yes, yes. Actually, what happened? Having a voucher is give us a choice to go and buy, our own fruit and vegetable, whatever we wanted, and we go to different shops to go and choice, and
Yeah.
also you give especially name, name of the shop as well. So we just go to the shops and gets. And I'm really happy with the recipe also. Like I really looking forward every week. Like there will be a recipe in the envelopes, and the recipe also like a very simple and easy way to use, and also the nutrition you need to be used how much for our family kids, and and also the healthy like fiber day, these sort of things is following recipe also. And I'm happy to see also voucher because sorry, the recipe, because what I do, I follow your recipe each and every week, not every week honestly actually, but sometime I do. But I also open a YouTube channel, my own like cooking recipe. So I did one or two recipe use and uploaded on YouTube as well. And yes, it's called one of the recipe called is pasta ratatouille bake. I use that. Yes. So I have collected all your recipe in my folder as you said before, collection. I did all this. I didn't miss out any recipe because maybe future I'm going to start using all the recipe and try myself with my kids and children in a family. Yes.
Brilliant.
Yes.
That's absolutely brilliant, Salma. So thank you. Yes, so Salma actually created a YouTube channel, and then so for each week she would go use the vouchers, buy them from the local. You've got 3 or 4 great fruit and veg stores, haven't you, in Tower Hamlets, quite near where you are. And then she would do a YouTube video of her cooking the recipes. So if anybody wants a link to Salma's YouTube video, perhaps you could put it in the chat. So is that okay?
And and what happened every week, like they are giving the 100 in time, like afternoon time. So I've been waiting all this today, like every Tuesday usually come. If it's missed out, then still
Brilliant.
I just knock on when they knock on that door. I was so excited. I know there is a recipe coming.
Great. Okay.
I can say
Thank
that
you so
also.
much. Thank you so much,
Thank
Salma.
you.
That was fantastic.
Everyone is well who helping us, our community, and very helpful. Thank you so
we
much.
hope we can hope the scheme's going to come back to Tower Hamlets, don't we?
Yes,
So,
hopefully.
All
Yes.
right. Thank you,
Thank you
Salma.
so much.
Thank you.
Thank you. Bye.
Okay. Bye-bye. So thank you. That's great to talk to Salma. So in the trial, we tested different methods for the bigger trial that we were planning in these areas. And we had similar findings to the one we did in Barnsley, which is, high levels of acceptability. But the importance of how there were some areas where the fruit and vegetables were quite a long way away, like 2-3 miles away, and there in those areas it was much less successful. So in one area we actually had a fruit and veg van that went and visited each week to the streets on a Sunday, and there that uptake was really high. Or if the fruit and veg stores were close by, the uptake was much better. And then the other thing we did was successfully develop and test a much more efficient method for redeeming the vouchers, where the fruit and veg vendors could scan the vouchers using their mobile phone app, and the fruit and veg vouchers, the fruit and veg vendors loved it. It was really simple. So that's it from me. I'll hand over to Carol. So if you need to contact me, then please do. I'm very happy to answer questions.
Thank you, Claire. That's wonderful insight. Thank you again to Salma for joining us as well. I'm not sure that David Barrett's online. If he is, can you please unmute? But I've been having some offline text conversations with him, and I think there's some technical issues in here. So I was hoping to bring in David Barrett from Tamar Fresh, but I have a feeling that the tech has got in the way of him joining us. So he doesn't appear to be shouting at me. So I have to assume that he's not managed to make it work from out in the field. So I'd like to just leave a few minutes for questions from the floor. I had a little section in here to talk about impact and aspirations beyond FoodSEqual Health, and really where we see this sort of thing going in the long term. And it slightly comes back to that return on investment point I talked about early on, in that what we would love to happen is for people in public health teams in local authorities to see the value of providing this sort of intervention that gives people access and affordability of a healthy diet through incorporating fruit and veg, and to be able to see the benefits that that gives on well-being, on health status, and so on. And of course, that has a value. When it comes down to the languages that politicians talk, if we can improve people's diets and therefore reduce the level of non-communicable diseases within the populations, reduce the need for accessing some of the other primary care or mental health care services, for example, because well-being is improved, that actually has monetary value on it. And although it seems quite hard to talk about things in terms of hard finance, that is a language that our politicians and so on understand. And so we, to a certain extent, need to try and express it in that way where we can. So we do want to show a value for the intervention, but beyond that, also with our fruit and veg vendors, if this is a viable business strand for them, we need to explore that. Is there a viability to supplying fruit and veg in this way for their businesses? Does this give an opportunity for economic growth within an area by allowing these sorts of businesses to proliferate, perhaps? So those are the sorts of things that we'll be examining when we come to the evaluation of FoodSEqual Health. I think I should stop talking now, actually, and let people who are in the webinar have their chance to ask questions. I can see the chat, so you can either put things in there or just use the raise hand function and come in and ask questions directly. So something coming into the chat. So from Rachel, the prices of fruit and veg, how will you decide on prices to charge? Will it be at cost? This is a conversation to have with each of our stakeholder partners. I know that we're doing things slightly differently to the way that Claire has run things in the past. So in the past, there have been more than one vendor in an area, and that element of competition has prevented a vendor from inflating prices, for example, in things like Tower Hamlets, where there are market stalls and so on. Because we have trusted relationships with our vendor, then they're not going to exploit our local community members by setting the prices sky high. Clearly, they have to run things at a price that works for their business, so they're not going to sell it, put it below the wholesale cost that it costs their business. But however, when it comes to things like setting up the market stall in Reading, we're going to staff that with some of our community researchers in the first place. So there's, if you like, there's a cost implication there that we're going to hide by doing that sort of thing ourselves, and that will have to be then become part of the process evaluation as to what the real cost of that would be, and therefore what would it do to the prices of fruit and veg if that business model were to become more permanent. I think one of the exciting things about this is we do start to look at slightly different business models. These are wholesale vendors that don't normally sell directly to the public in that way. And here we are working with them to develop different methods of doing that. Are there business opportunities here? If not for those vendors, for others that might see something in that space. Sophia asks whether people in different areas got more for their £5, in Sheffield, because London's generally more expensive. Claire, I don't know whether you want to answer that. I mean, clearly the types of markets that people were accessing perhaps were not the same as a supermarket.
Yes, I mean, people are we're very careful with regards to how much we pay for food, and the less money you have, the more careful you are, I think. So people did actually compare prices, but they also compared the quality of the fruit and veg and also how long the fruit and veg lasted. So some said actually it might be cheaper at Asda, but it rots within a few days. Where if I get it fresh from the market, then actually it'll keep for a week or so. So and yes, it did vary, but it varied according to the different areas and the market forces and prices in that area. Yeah. Good point.
Yeah. And Claire, can I ask you to stay on for the next question from Decha, which was around the structure of the trial and about potential contamination between the two arms of the trial, because there's a potential for vouchers to be shared.
Yes, so we're taking a very pragmatic approach here by actually knowing that the key thing is that people need to, if the scheme is going to work, people need to be able to get to the fruit and veg. Then it needs to be at the right time in the right place with the right welcoming smile, the right type of fruit and veg. So we've made sure that we've got great relations with these different community hubs. So what Carol says is a hub-centric distribution plan we've got for the 6th and 7th test of the Fresh Street idea. And so we've picked these hubs who are working with us in a fantastic way to create a source of fruit and veg, fresh fruit and veg for their local communities. And then we're being very practical and picking streets closest to those where the fruit and veg is, and offering them the vouchers. But anybody in the wider area can also actually just go to the new fruit and veg stall at the community hub, which is fantastic. If we get more money from local councils or wherever, we may be able to actually expand it. But at the beginning, we're testing this very new model of a hub-centric distribution method. And there may be contamination, but this isn't a rigorous randomized control trial. This is actually testing what works. There's no point designing something really complex if you haven't got an intervention that works. So we're still making sure that we can evolve and get a range of different methods for how we increase access to support communities to eat fresh fruit and veg.
Thank you, Claire. And I'll pick up on Rachel's question, which is something that we actually discussed within the project as well. Whether we create barriers between neighbours in a community because some get vouchers and some don't. We did wrestle with this one a bit, and we still do to some extent. And it's the challenge of trying to do the right thing for a community, and doing research. Fortunately, we're already working in these communities. We have done for a number of years. We have trusted relationships with our community members and a greater understanding of what research is. So we don't think we're going to have these barriers in place because the communities that we work with do understand that this is research and things like the vouchers are time limited. The intervention is 12 months. They're not going to be there forever. But by participating in the trial, whichever arm of the trial they're on, they will be contributing to that research. They will be getting other benefits, even if they don't get the vouchers. And so it's not a kind of complete have and have not. But this, again, is one of the challenges of doing research rather than just supporting a community. Claire, do you want to come in on that one, or was there something else?
Yes, no, exactly. We've wrestled with this in each of the 5 areas where we've tested it, and we get some people saying, why aren't I getting the vouchers? And we just explain, this is research. This is not government policy, it's not local council policy yet. We're testing out. If it works, then it's possible that it may be developed and a wider area of houses and areas will be able to have it. And people get it. They go, oh yeah, okay, because I hope it comes to me. So yeah.
And again, we hope that by demonstrating the willingness and the effectiveness of participating in this research, we do start to make an argument for doing this in a longer term basis. And so eventually we'll tick both boxes. We'll not only do some really good research and really interesting stuff, but we will also help those communities. And for me, one of the reasons I'm so excited about this particular aspect of the project is having worked with our communities for a couple of years and engaged them in all sorts of research with slightly limited immediate returns for the people that have been helping us with our research. This intervention gives something back to them in a way that makes them see that engaging in research is really valuable. not only has it helped us, but it's something a little bit more tangible than perhaps we've been able to provide in the past. And that matters. I think we all want to do research that makes a difference in the real world. And I finally kind of feel that we might be getting closer to doing that. I think in the view of the time, I'll have to stop there. Thank you so much, everyone, for joining us. Thank you for being so actively chatting away behind the scenes as well. Claire, thank you for your contributions, and Salma, of course. I really hope that we welcome you all to the next one of these, which I think is in 6 months' time, where we'll be able to give you an update on all sorts of aspects of this intervention and how it's going. And we promise the warts and all. We'll tell you the stuff that's not going so well as well as the things that really are working, because it's all a learning experience. So thanks very much, everyone, and see you soon. Bye for now.
Thank you.